Hey, it's your girl, Shy Roslyn. Happy Thursday? Yeah, Thursday. Happy Thursday. Um, I haven't done a chemo life update in a while because I really didn't have anything to update. A couple months ago, I started a new medication called lymphema. It it worked, kept the cancer away. Everything's good. And then about a month ago, 6 weeks. Well, it's a little over 6 weeks ago. I started getting swelling, and my left leg was swelling and bruising. Couldn't figure out where it was coming from, and went to the cardiologist in my regular checkup, and she said, "Yeah, you don't have any clots. They did the test, no clots in the leg." She said, "But it's weird that the swelling is mostly on your left side and not your right." But she said, put some um, compression socks on and, follow up with the oncologist. So I reached out to the oncologist. I'm like, hey, my foot's swelling up and I got this bruise and I didn't fall. I don't know where this bruise came from. So she said, you know what, go see a dermatologist. I'm thinking dermatologist for bruise? Whatever. So I was to go see the dermatologist. They squeezed me in day before yesterday. And so I said, you know what, let me just go. So I went. That lift bill, man, that cab bill was crazy. But I said, you know what, let me just go. So I go, and the young man says, well, it could be the chemotherapy. It does cause changes in your body. He said it could be the lymphema, it could be the Keytruda, it could be age, your body's changing. Excuse me, young man, I am not old. I'm barely in my 60s. Leave me alone. So, he said, I'll let the oncologist know. I forgot, he called it, some kind of vascular dermatitis thing, something like that. I have to look it up because I couldn't pronounce it to save my life. But he also said compression socks, and he said there's a little bit discoloration on your right leg, and I'm like, oh no, don't tell me that. So he said, yeah, get compression socks, get a new pair of sneakers, because the more support the better. Wear the compression socks during the day, and there's a cream I have to pick up at some point. I was supposed to go today, but I'm too tired. And put the cream on twice a day, he said. I'm like, okay. So yesterday I went for my chemo treatment, went for the Keytruda. The good news is I don't have to use the port for the Keytruda anymore. I'm keeping the port just in case something goes funky with the injection. But they basically gave me an injection. It's like a flu shot. But it hurt. The Keytruda, they usually put it in the IV because it drips and it's kind of not watered down, but it's a little more liquid, so it just goes into the IV. Ciao. Injection, the medicine is thick. The needle is not that big, but the medication is thick. So when they do the injection, they have to really push on the needle, and it actually burns a little bit. So it took a while for her to do the injection. And on top of that, I still had to wait for the pharmacy to draw up the medication. So I saved maybe a half hour doing it as an injection. So, I ended up getting that. So I did get a little bit quicker. Not a whole lot quicker. But a little bit faster than I would. So, That's kind of the good news, bad news. And I get home, I get a message from my oncologist saying, stay off the lymphema for a month. Because I go back to the dermatologist next month, and she said, stay off the lymphema for a month. We want to see if that's what it is. The medicine that was actually like really keeping the cancer away, I gotta stay off of it for a month. I tell you, if it's not one thing, it's another. So I'm off the lymphema for a month. I go back in my usual 6 weeks for the Keytruda. And we'll just have to see what happens. But that's what's going on. I really thought I know I have this thing beat. This is just like a little hiccup in the road. But hopefully I'll still be okay. And it's funny because I didn't like the lymphema when I first started taking it. I didn't like it because I was having digestive issues and whatnot. Now that I'm actually like, okay, it's working. Let me keep going. I gotta stop. So we'll see what happens in a month. But my blood work was beautiful. Everything was nice. My cancer marker score is at a 5. It actually went down. I was so excited. Even my thyroid test is starting to even out. Everything is evening out. I gotta stop. So that's what's going on in the chemo life. And as always, this is not medical advice. It's not medical advice. Each patient is different. Please consult with your provider regarding any type of treatment questions, all that good stuff. I'm just sharing what's going on with me in case anyone has questions in general about what can happen when you're going through chemo. So, likes are free. Sharing is caring. New subscribers are always appreciated and welcome, and respectful questions are also appreciated and welcome. So, I'll see you guys in the next one. Have a great day. Peace.